Good afternoon. I'm impressed whenever we get results as immediate as we did the other day with a gentleman who we've been working with, both with combinations of physical therapy, acupuncture, trigger point injections for a shoulder injury that occurred when he was at work. He thinks it might have happened with weightlifting. There are lots of other activities he does with his shoulder, but this seemed to be a repetitive overuse problem. And weekly we had done acupuncture. We had added some trigger point release into the soft tissues. One day though, he was describing pain in more locations that seemed to be more related to insertion sites of what we refer to as parts of the rotator cuff. If anyone has injured their shoulder, worked with a PT or other care provider and heard that term, these are attachments onto the proximal upper part of the humerus where muscle and ligament attach to bone, and when the muscle activates, it rotates and moves the shoulder in certain directions. On careful palpation, one can find often areas that represent where the patient is identifying pain. Prolotherapy was our tool. And the following day, the patient called back saying the pain was gone. So what did we do? With the dedicated mechanical examination of the shoulder, followed by careful palpation of the landmarks over the shoulder joint, we identified the problem spots, which were very point tender. These were prepped and treated in the typical way that we do prolotherapy using dextrose solution. And again, within 24 hours, a result such as this is not unusual. In fact, many will get off the table and for various areas that we're treating may not even feel their pain that brought them in. I'd also like to mention the applications with a shoulder injury where PRP or platelet-rich plasma may be more beneficial. Those are cases, case proven, where on sonographic or MRI imaging, there is a partial tear identified in one or several of the attachment sites where these ligaments are identified, and they appear differently under ultrasound imaging. We offer the service at our office, more importantly, to be able to be much more precise in areas where there's specific trauma. So with visualization in real-time musculoskeletal ultrasound, you can see these defects, and the use of PRP is favored in these because they're stronger, they contain more reactivity, more growth hormones that would provide a structure for the area to fill in and heal. A non-operative way of helping along with physical therapy and other strengthening. So a recent case where I thought might be worthwhile bringing up what prolotherapy sometimes can offer for musculoskeletal medicine. Alrighty. We will try to do an example of a joint that is typical to come in the office on a regular basis. So I figured we'd start off with a recent case of shoulder pain. All right. Have a good day.